Hello, everyone, and welcome to the webinar. Um, the main thing I'm going to do in this webinar is talk about how to stay safe in this climate of COVID. So I'm going to primarily talk about that, how to boost your immune system and stay healthy with COVID, but it applies to any viral illness because they're kind of similar. So what exactly is the burden of COVID? So the real thing is that this virus is out there a lot, and because we don't have enough testing, we don't know who actually is infected. My guess is a lot of people are infected but don't get testing. And because if you remember, this started in China back in October, November, and we had open travel at that time. So I'm sure a lot of people have already gotten over it and have antibodies to it. Again, because we don't have testing for those antibodies, we don't know who has it, who doesn't. The only way we find out is if they get significant symptoms. So my guess is there are lots of people walking around either with no symptoms or with antibodies themselves. Now, in terms of the mortality rate, I know there is a lot of sensationalism and fear from the media, but I actually just saw an article today from Lancet, which is a British journal, and they had looked at the numbers from China, and the mortality rate actually is 1.38%, as opposed to the higher numbers. Now, of course, the higher numbers are in patients that are older and have comorbidities. But we don't have good data for it in the US, but based on numbers from countries that do have, for example, Germany, China, Switzerland, we are seeing rates of just about 1%, slightly more. Put that in perspective, the mortality rate from the influenza, which we get every year, is just under 1%, based on the WHO numbers. And then a lot of you might be seeing things about masks, yes or no. So the thing with masks is the masks, the N95, which looks like this. This is the N95. This is good for particle sizes, viral sizes of 0.3 microns. Okay, 0.3 microns. It won't let anything that's bigger than 0.3 get through the mask. The particle size for a COVID particle is 0.1 microns. It's way smaller. So is it actually going to prevent a small particle from going in? Likely not. However, if you are with somebody and you get exposed to direct droplet contamination, then that will protect you. So that's just a few basic things about COVID. Now, this talk is not to replace anything that the federal government is doing in terms of separation, 6 feet distancing, or hand washing, or stay at home, or masks, or any of that. This is obviously in addition to that. And how do I know, or what authority do I have to speak about it? The information I have is based on about 200 articles that I've reviewed, and also based on my personal experience in my office. So that's where I'm speaking from. All right. So the COVID virus actually is a kind of a SARS virus. The difference is it's highly pathogenic, though, compared to the others, because there's a lower pathogenic and a higher. So the COVID is highly pathogenic. It affects mainly the lower airways and causes pneumonia because of rapid replication, rapid multiplication. And that is the key to this virus, is its rapid replication, which causes massive inflammation. And that is what causes the lung injury and people needing ventilation support and subsequent death. So that is the key. Remember this, because we'll keep coming to this in our prevention and treatment protocol. Just to give you an idea of what it looks like. So that is what the viral particle actually looks like. There is the inner layer, which is kind of the reddish one. And there is the outer membrane, which is the other two with the blue particles in there. And then there are these yellow spikes, which actually, that's how the virus gets attached to a host cell or to the lining of the lung. And then it attaches and then goes inside the cell. Now, once inside a host cell, it uses this enzyme replicase, which is dependent on zinc. And it uses that enzyme to replicate itself in the host cell. And that's how it destroys the host cell. And once it destroys the host cell, that's where our immune system comes in to protect the host. Now, this piece about the enzyme replicase is important, which is why I'm mentioning it, because it's dependent on zinc. What if we have higher levels of zinc in the cell? It stops this replicase enzyme from working. And part of, I don't know how many of you have been hearing about the hydroxyquinoline. That's how it works, is by increasing levels of zinc in the cell and decreasing the replicase activity for the host. So that's how that works. And also we'll be talking more about that in our treatment prevention part. Just to give you an idea of comparison between COVID and the other influenza and cold, the biggest difference is the incubation period for COVID is 1 through 14 days. Flu and cold are shorter, which is why people walk around without symptoms and infect others with not as good an immune system. And that's where we talk about segregating people to flatten the curve because of the long incubation period. And also the symptom onset is very gradual. So you wouldn't know if somebody's walking around if they're positive, carrying the virus or not. The most common symptoms are cough and fever. But as you can see, the rest of the stuff with the symptomatology is no different than flu or cold. There is sometimes diarrhea with COVID. It's rare with a cold. I alluded a little bit to the phases of infection earlier on. There are 3 phases. So what happens with the first phase is the virus goes into the first lining of the respiratory system. And it's the endothelial lining. And it's also the lining where the cells produce the mucus, and the cilia, or tiny little hair on the cell, they help clear out the debris. So the virus goes in there and starts multiplying and destroying that top lining of the respiratory system. Now, when these cells die off, a couple things happen. They fall off, and this debris blocks the rest of the airway. But it also then causes mobilization of our immune system to clear them from blocking the airway and repair the lung tissue. And what happens in this mobilization of the immune system is we could get a flooding of the immune system, like it could be an exaggerated response from the body. And when that response from the immune system is exaggerated, in the process of cleaning the debris, it actually causes damage to the healthy lung tissue. And this is what sometimes causes fluid buildup in the lungs, which is what causes the drop in the oxygenation. And people need to be put on ventilators. And even then, it's hard to give them enough oxygen because your lungs are now filled with fluid. Also, when patients are recovering from it, the same exaggerated response can cause fibrosis of the lung. So people may end up with not completely recovering their lung function. Here is a diagram of what I was speaking about earlier. If you see on the left, where it says the normal alveolus, where you see the bronchial epithelium, the blue cells up top, they are normal. And then on the lung injury side, that initial layer of cells that produces the mucus and that has the cilia, the lining, hair lining, the cells which push the mucus away, they are damaged and they slough off and they block the remainder of the airway, the alveoli. And then as that cell lining is damaged, now fluid can come in from the blood vessels and the surrounding area and go into the alveolus, or which is the pocket, the air pockets in the lung. And then that makes it harder for oxygen to go in and out of the air sac into circulation, which is what you may hear the doctors talking about, like the patient's oxygen was low because now air cannot exchange as easily between the alveolus, which is the air sac, and the blood vessel because of the fluid buildup from the exaggerated immune response. And what happens is, in terms of symptoms, these are, the top one is survivors and non-survivors. It's the same for both. The initial symptom is fever and cough for survivors and non-survivors. The difference comes in at day 6, where you can see it goes into dyspnea or shortness of breath, okay? Once we get into shortness of breath, that means we've already had fluid building up in the lining of the lung, as I was talking about earlier, in the air sacs. And then that goes into sepsis and ARDS, which is acute respiratory distress syndrome. So the key to treatment of this virus is to treat early, treat fast, but there's also, we don't want the immune system to be shut off in the initial phases. We want it to work to kill the virus, but we also don't want it to give us the exaggerated response, which is what causes the dyspnea, the sepsis, and the ARDS. So I'm going to use, based on this slide, here is another depiction of the same thing. So there is the early phase, the more towards the left, where there is mild symptoms, a little bit of fever, dry cough, some diarrhea. And then we get into the phases 2 and higher, where the host inflammatory system has fired up. And now you're getting into shortness of breath, sepsis, and shock. So our treatment part, I've divided into treating stage 0 to 1 and treating stage 2 and 3. Now, 0 to 1 is based on this previous slide in the first part with mild symptoms, or somebody who came into contact with somebody who was COVID positive, or somebody who has very mild symptoms, a little bit of fever and dry cough. And stage 2 and 3 are people that are running higher fevers, getting short of breath, okay? But if we can treat people in stage 0 and 1 and prevent them from going into stage 2 and 3, that is the best protocol, because I've already mentioned it, because once it gets into exaggerated immune response, then we've sort of lost the game. So my understanding is that once people get on the ventilator because of the difficulty with oxygen exchange because of fluid buildup from the immune response, it is almost impossible to get the patient off the ventilator. So stage 0 and 1 is somebody who's been exposed, or has very, very mild symptoms, or even tested positive but has no symptoms, is somebody I would put in stage 0 to 1. And so in this stage, I would look to do the following. I would aim at optimizing the immune system. So making sure the immune system is active but not exaggerated. Make sure the white cells, which is the body's army, is up to snuff and working. Make sure that we are breaking down the capsules of the virus, okay? Keeping a alkaline pH, preventing the immune response and the creation of the reactive oxygen particles, blocking viral replication, preventing the blood from being too thick and pooling, and modulating the cytokines, which is the stuff that our immune system releases when it comes in to clean up the dead cells, which is then what causes the leakage, remember? All right, so the first stage would be aimed at all of these, doing things to optimize immune system, kill the cell lining of the virus, prevent it from multiplying, and preventing the exaggerated immune response. So the way I recommend, and I do in my office, is first and foremost with silver hydrosol. Now, it can be anything from 10 to 23 parts per million. What I recommend is I have the upright nasal spray. So we have to get it delivered to as close to the viral particle as we can, and it lives in the upper airway, in the nasopharyngeal part of the airway is where the virus usually starts and lives. So if you can deliver the silver directly there, I recommend doing 4 sprays on each side a couple times a day. And it's liquid, so you have to kind of tilt your head back, let it go down into the back of your throat, and then swallow. Then the silver is actually going to help with the breakdown of the cell membrane of the virus. Vitamin C is very good to stabilize that lining, the first lining, the endothelial cell lining, which is the first lining of the cell, which is where the virus comes in and multiplies. And you can do it IV and oral, intravenous or oral. Intravenous absorption is 10 times more than oral. And also vitamin C doesn't have a very, very long half-life. So what I do in my office for myself, my staff, and my patients is I recommend a weekly IV of 20 grams of vitamin C. And the reason I say 20 grams is that's based on the literature from Shanghai, where they did do IV vitamin C on their patients, and they were recommending between 14 and 20 grams. So that's what we recommend. We do 20 grams IV. And then I suggest people do 2, 3, 4 grams, as much as you can tolerate every day, to kind of sustain that level through the week. And again, there are various oral forms. I hear from some people that it's getting harder even to get things like Emergen-C, which is commonly available, used to be commonly available. But any form is fine that you can find for oral use. I wouldn't recommend just doing oral because, again, the absorption is not as good, and you really need to stabilize that cell lining where the virus actually first starts. Vitamin D3 is, again, a very good stabilizer of our immune system. Most people have very, very low vitamin D levels. Sometimes when I see people in my office, the levels are like 10, 15, 17. We actually need the levels to be between 70 and 100. So it takes a lot of vitamin D to get there. I've read studies where it takes about 5 to 8,000 units just to maintain a level, especially when we are in acute crisis state. So I'm recommending to my patients that have very low levels between 10 and 15,000 units a day. If I know their level is pretty good, then they're taking 5 to 8,000 units to maintain that. But basically, you need a lot of vitamin D to support your immune function. Curcumin is an excellent anti-inflammatory, and the trick again here is we don't want to take too much of curcumin. We don't want your immune system to be turned off. We just want it to be blunt. So it does the job without doing too much damage to the native cell. So in this stage 0 to 1, I recommend 400 to 800 milligrams of curcumin twice a day. Again, there are several forms on the market. Just pick the best one. Sometimes it is with black pepper, which helps the absorption. That's fine also. The next item is EGCG, which is a component of the green tea. And the way the EGCG works is on the zinc channels that we talked about earlier. So we want zinc in the cell to protect, to decrease the functioning of the replicase enzyme, which the virus uses to multiply itself. So again, EGCG has a very short half-life. It's like 4 hours, and you need to take a lot of it. If you can find something with a vanilloid, which will extend the half-life, that's better. In my office, in my practice, for my patients, my staff, and of course myself, we use an IV form of it, which has a vanilloid in it. So we do it once a week. Quercetin works similarly on the zinc channels, and it is also found in things like onions and raspberry, but you can get it in a supplement form, and I would recommend maybe 500 milligrams a day orally to help with the replicase enzyme. Zinc, we already talked about. Epigenin is an immune modulator, again, commonly available as a supplement. You can get it anywhere. The next 3, iodine, selenium, and melatonin, are important in optimizing the function of the white cells, which is the first line defense of the body. The N-acetylcysteine it helps stabilize the lining of the lungs. The nattokinase or Plasmanex helps with making your blood a little thinner. So if your tendency is to have thicker blood, which you wouldn't know because it's based on a blood test called fibrinogen. But if you have had that blood test and it was more than 300, then your blood has a tendency to be thicker or pool in the areas, and we don't want it to. We want it to be freely flowing. Then you can do nattokinase, again, 400 milligrams a day should be plenty. The next one, DHEA, is a product of the adrenal gland, and most of us who have gone through any number of years in life have suffered some adrenal damage. So most people have very low DHEA. Now, I've read studies where they gave 100 milligrams of DHEA to people just prior to surgery, and the outcome was very good because it prevents people from going into shock. And so again, with the viral infection, you get into shock, and then sepsis and shock come together. So DHEA, if you know your adrenal function is compromised, then I would recommend doing that. The word about Plaquenil is, again, it works by affecting the zinc channels, and that's where it's useful. Unfortunately, it's not widely available, And even if it was, we would need to take it a lot, especially when we're treating phase 0 and 1. A word of caution about elderberry extracts: it actually increases your inflammatory cytokines. That is how it works. And remember, we don't want that. We don't want the exaggerated immune response for this. So I wouldn't recommend elderberry extract for this one. I would highly recommend just general things to maintain your immune system. So have a healthy diet, avoid a lot of sugars, do gentle exercises. A lot of stressful exercise is a stress on your immune system. So gentle exercise, and avoid alcohol. Anything more than 1 drink a day will break down the lining of your gut, just like the respiratory system. The alveoli I showed you had that 1 cell lining. Everything in the body has that top layer, which is called the endothelium. And as we drink more alcohol after 1 drink, it will start breaking down that top lining of the gut. So what that means is we get what's called leaky gut, which means things that were supposed to be contained in the gut can now leak into circulation, which then triggers our immune system. And again, remember, the whole goal is to have some immunity or immune function, but not an exaggerated one. So again, avoid alcohol. Other general tips: make sure you get plenty of sleep, good sleep. Refreshes the body, maintains your adrenal function, and balances out your immune system. When we sleep, that's when the body is regenerating itself. And the last thing that I want to talk about is, again, do not, please avoid listening to the drama that the media puts out. It's all a fear tactic, and actually fear increases the response of your immune system. So what I would recommend instead is watch a funny movie. Laughter. Laughter is the best medicine. There are studies done that 20 minutes of mirthful laughter will rejuvenate your immune system for up to 12 hours. So I urge you, for you and your family and your kids, don't watch scary movies. Find something funny that you can watch together as a family. So that's about it. I hope you found it useful, some things to consider. If you have any questions, please feel free to reach out to us. The website is the email address is info@thefunctionalmedicinemd.com. You can find us on Facebook. You can go on our website and schedule complimentary phone consults. I hope you can find some of these supplements that I recommended online, or if you want to try an IV, we do recommend them once a week. It has worked very, very well for my patients here. Well, thank you, and God bless.